Following up on yesterday's video, we have now what to do about the different signs that you might have a spike protein blood clot. Might as well just hop right into this, and if you haven't caught yesterday's video, it'll be probably one of the goofy little iCards above my head, so don't worry, just go back and watch that one. You'll get caught up to speed on everything that we figured out yesterday as to the development of the clots. So hopefully now we can figure out what you can do if you find yourself in this situation like so many other people have, unfortunately. And it's it's not a death sentence or anything like that, but it's something you should be, at least aware of, okay? But your feelings about the situation may vary, okay? So, normal negative COVID test results do not completely exclude from, the potential of clots. Regardless of whether the diagnosis is confirmed or not, if there is a symptom, most important step is to prevent it. So, what do people test for? How do you figure it out, okay? Activation for the clotting cascades leads to both large clots as well as microclots. Okay, as long coved, supposed to be an eye in there, pal. Symptoms have and may indicate the potential existence of microclots in the body, including but not limited to brain fog, memory loss, sleep disorders, anxiety or depression, chest pain, breathlessness, tachycardia, fatigue, post-exertional malaise, weird, in the legs. Swelling is the most common side of a blood clot. If you have significant swelling on one leg, call for a doctor right away. Yeah, it's swelling, and it seems that there seems to be a lump in there. I don't know what it is. Really? Okay. Some patients have symptoms called COVID toes, red swollen toes, that might well be due to small clots in the blood vessels of the feet. Weird. Okay, clinical studies show that patients with the COOF have increased fibrinogen, okay, fibrin degradation. I know I'm mispronouncing that, but I don't care. Products D-dimer, okay, and von Willebrand factor. We talked about that extensively yesterday. And these elevations appear to correlate with severity of a disease and risk of clotting. Here are a number of basic screening tests that could be considered if somebody has long COVID-like symptoms. All right, so this is what your doctor should be aware of, but at least you can be as well. Complete blood count and differential and platelet count. Okay, D-dimer has a marker of clotting activation, and markedly elevated D-dimer indicates the abnormal clots and the fibrosis is activated. CPR, a simple, cheap, and sensitive marker of ongoing inflammation. Fibrinogen factor 8, okay, and von Willebrand factor. Okay, all of those should be tested for. All right, so anti-thrombotic therapy. Okay, Dr. Jordan Vaughn, internal medicine specialist, says it is key to start antithrombotic treatment in affected patients as early as possible. After reading and understanding that the COOF-associated coagula therapy, it is critical to understand this pathophysiology and manage this unique disease state because of all of the hypercoagulable and acute severe COOF. I would treat patients with antithrombotic therapy and have them come back every few days to see if their symptoms improve. It was after the success of antiplatelet and anticoagulation in the acute treatment of the COOF that I started to wonder about the utilization of the post-acute sequence, or sequale, whatever, COVID, and it was led by diligent research in the work of Jaco Lobsher, Raisin Petrulius, and Doug Kell. Steep drop off in naming right there. Okay, it was as if a light bulb went off and I read their work and profoundly changed the way that I took a look at both acute COVID and most importantly long COVID, PASC, which is post-acute sequelae COVID, PASC, okay. It has been reported that suitable and closely monitored triple anticoagulant therapy leads to the removal of microclots and also removes symptoms. It is a dual antiplatelet therapy, DAPT. Okay, there you go. Cipoprodil, 75 milligrams and 75 milligrams of aspirin once a day, and direct oral anticoagulant, apivaxapan, 5 milligrams twice a day. Cool, wonderful, fantastic. Okay, obviously, your mileage may vary, your dosage may vary, hell, even the medications you take may vary. Obviously, your Your healthcare provider will know better, unless you're in California. Then your politicians will know better. Anticoagulants slow down clotting, thereby reducing fibrin formation and preventing clots from forming and growing. Antiplatelet agents prevent platelets from clumping and also prevent clots from forming and growing. Makes sense. Abipaxin, sure, is a class of anticoagulants. Exogenous heparin, okay, can significantly reduce coagulation caused by spike proteins and provide fundamental support for anticoagulant therapy, especially those critically ill COOF patients. And if you like a little diagram to describe everything that goes down in the creation going on within your body, there it is right there in 4K living color. Platelets down, okay. Plaxvid, okay, blood thinner, prevent heart attacks and stroke in people with high risk of those events. Aspirin, of course, all treatments, prescribed. Of course. Nutracellular and thrombotic conditions, a variety of dietary supplements that have been beneficial effects on thrombotic conditions. Meanwhile, compound have anti-inflammatory, antioxidant, and autophagy boosting effects that are beneficial for COVID-related symptoms as well. Flavonoids, resveratrol has antiplatelet properties. It is a naturally occurring flavonoid primarily found in grapes, red wine, and peanuts. I even got an entire video on resveratrol on the channel. At least the name sounds familiar. Should be in the diet playlist, or the it would be in the vitamin and nutrient breakdown playlist if you would so like to check it out. Gencitin, okay, don't know about this one. Tyrosine kinase inhibitor is an inhibitor of platelet aggregation and its effects in preventing thrombotic occlusion in blood vessels. It is found predominantly in soy products. Gross. Garlic. Oh, wonderful. The compounds of adenosine, allicin, paraphenetic polysaccharides, or sulfides, appears to be responsible for the inhibitory effect of garlic and platelet aggregation. Cool. Antioxidants, obviously, vitamin E, selenium. You know the deal. Take those for antioxidation. All right. Drug interactions. Supplements have been reported to affect normal coagulation and platelet activity, and or have been reported to possibly interact with coumarin. Anticoagulants include danshin. Don't know about that one. Garlic, ginkgo, American ginseng, Asian ginseng as well. So ginseng all around good. Diet and exercise. Widely believed that eating fruits, vegetables, and getting physical exercise, is beneficial to thrombotic status, especially in those who are at risk of thrombotic disease. Vegetables and other processed diets were classified as healthy include. Holy, let's run this down. Raisins, grapes, prunes, bananas, cantaloupe, watermelon, fresh apples or pears, oranges, grapefruit, strawberries, blueberries, peaches, apricots, plums, tomatoes, tomato juice, tomato sauce, broccoli, cabbage, cauliflower, Brussels sprouts, carrots, mixed vegetables, yellow or winter squash, eggplants, zucchini, yams, sweet potatoes, spinach cooked, spinach raw, kale, mustard orchard, greens, iceberg, head lettuce, romaine, leaf lettuce, celery, mushrooms, beets, alfalfa sprouts, garlic, corn, nuts, peanut butter, string beans, tofu or soybeans, beans or lentils, peas or lima beans, vegetable oil used for cooking, tea, coffee, decaffeinated coffee, everything under the sun, basically. As long as it doesn't come out of a bag or a box, you'll be copacetic. Less healthy apple cider or juice, orange, grapefruit or other fruit juice, white rice, baked or mashed potatoes, or corn chips. Interesting. Mind-body interventions. Many pathological similarities between chronic symptoms like myalgic encephalitis, ME, and chronic fatigue syndrome. Why you gotta shorten that one? Okay, the first one needed a little bit more. Canadian researchers conducted a systematic review of the mind-body interventions. All right, fatigue severity and depression and physical and mental functioning were shown to be improved in patients receiving MBI. eyes. Mind-body interventions. Imagine that. Interventions included mindfulness-based stress reduction, mindfulness-based cognitive therapy, relaxation, qigong. That wasn't the doorbell. That's the type of therapy, I suppose. Cognitive behavioral stress management, acceptance and commitment therapy. Yeah. I got jokes, but that's fine. 12 out of 382 retrieved references were included. 7 studies were randomized controlled trials. Cool. So do all of that type of stuff and you'll be better off. All right. So perspectives for the future. What can we expect going forward? Hopefully it's better than what we're dealing with right now, because we're finding out a whole bunch of different things as we continue to collect data. It's almost like we should have been doing this beforehand instead of just fear-mongering. Anyways, we are facing unprecedented challenges during the post-COVID era. The virus has not disappeared from the human world, and the long-term sequel and vaccine-related syndromes have hit us heavily. The strategy for rushing to produce a vaccine against the emerging virus were not fully come to understand, and then pushing it onto a majority of the human population in order to participate in polite society. Obviously, wonderful, fantastic, is a fundamental mistake. Spike protein has taught our world such a big lesson, despite being on the cliff's edge of disaster, and the solution is nature and tradition. Yeah, exactly. Living a healthy, active life. Wow! And plenty of the remedies that seem prepared just for humans are here to help and cure us. It is never too late to learn and never too late to change. But always, always, always keep up to the latest information. Consult your health care professional. That was difficult to say for whatever reason, but always, always, always stay on top of this stuff and select healthcare providers that also stay on top of this stuff, because if they're relying on data that we had from very early in this type of stuff, even if it's a couple of years old now, you better go over that again with a fine-tooth comb and with the current set of information available to you. But with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.